Hi, you guys. I'm Kiana Collier, RN. I'm the owner of Holistic Recovery and Wellness Spa, and we're here today with Dr. Fasusi and Tributo Bridging the Gap for Recovery Care.
Hey guys, one of the things I think is really good for us to start with is maybe the time period of what's involved in terms of the post-operative care. Let's just start with something like any type of liposculpting or liposuction case because it's very common. So after the surgery, obviously there's a couple different steps that need to take place. Compression is key throughout the entire surgery, and there's different phases that happens in. Not to mention the massages. After about a week after surgery, it's important that we are obtaining drainage massages. That's going to help the immediate leftover fluid and whatnot to be expressed, which also decreases postoperative pain and swelling and inflammation pretty acutely. After that first week, then we transition into about a 6 week period of where I recommend obtaining multiple lymphatic massages. And for most everybody, I would say at least 15 at the very minimum over a 6 week period would be what I would recommend. Front ending that, you're probably getting about 3 massages a week at the beginning at the very least. It's beneficial, and then you can space it out. But that's going to be a very coordinated dance between you and your massage therapist. The third and kind of upper echelon of massages is after the 6 week mark, where we utilize things like radio frequency, cavitation, wood therapy, those type of things to help with postoperative scar tissue, with smoothing things out, making things nice and even, and it really helps with contouring as well. In a nutshell, that's kind of the immediate postoperative regimen that I would recommend in addition to compression. Kiana, what thoughts do you have about that? That's what I educate my patients on, and that seems to work pretty well for me.
For us, our same post-op regimen aligns with what you're recommending. I tell everybody a minimum of 15 to 20 lymphatic massages. I do ask that they spread it out maybe 2 to 3 months because of the unexpected swelling
Hmm.
that occurs. And then I also try to have everyone line up with someone who specializes in lymphatic drainage, whether it's a registered nurse or a massage therapist who does specialize in specifically post-op recovery, because
Very
that's
true.
where the lack of information is coming from out
Right.
here in the community, that
Right.
they can just go to anyone from lymphatic drainage, and that's
Exactly.
definitely not the case,
Exactly.
because the recovery care can be actually serious than they a lot more serious than they actually understand.
Yeah.
All right, Dr. Fasusi. Now let's get into the stages of compression, because
Hmm.
that's what I'm finding out a lot as the patients are coming in. They don't understand what the actual stages are. When we say stage one, two, and three of level of compressions, they actually think that it's stages small, medium, and large.
No, that's a good point to stop on. When it comes to compression after surgery, this is the are not linear. And when I talk about what's needed, here's kind of what I'm recommending. Our stage one garment right after surgery is meant to be snug but not tight compression. And this is important for a couple of reasons. If you do very thorough liposuction, that does weaken the blood supply to the skin for a short time after surgery. What you don't want to do is do very thorough liposuction and then do very aggressive compression right after surgery. That's how you can run into issues in terms of ischemia, lipoburn. There's different terminology for it, but basically the skin is not getting enough blood supply, and that's what we don't want. The skin reperfuses pretty quickly after surgery. That's why I would utilize my stage one garment, which is not super tight compression, for about a good 10 days after surgery. And you're using that with your foams and your boards. And then once you're out of that window period, then we can then transition into the next stage, the stage two garment, which is meant to be very, very snug, but appropriately snug compression. And that's what I want you utilizing for 6 months. Now, you mentioned something about the stage two versus stage three.
Mhm.
This is something I think that confuses a lot of people because I think they associate, well, as I'm going, I need tighter and tighter and tighter and tighter compression all the way throughout the recovery process. Rather, I think the better way to look at it is this. Throughout your recovery process, let's just say from time of surgery to 6 months, you're going to be shrinking throughout that entire process as you
Right.
should, right? As you're shrinking, you need to keep up with the level of compression necessary for you to maintain your results. Everything is like Goldilocks. There's too much and there's too little,
Right.
right? We want to be just right. I think it's important for us to know that as, let's say, for example, when we get to 3 months to 6 months in terms of our recovery process? Well, we've probably shrunk quite a bit. We have a lot less swelling, a lot less inflammation, but we still have some room to go. It's definitely something I see where we need to either get the faja resized smaller or get a new faja because your size is not your size anymore.
Right.
And that's a good thing, right? It's a good problem to have when you're at 3 months and we're like, man, this faja is becoming a little bit loose. I need to get it tightened
Right.
up. Keeping up with the adequate level of compression is really what's key throughout the entire process, not necessarily just going by a stage because everyone's different in terms of when they're going to meet those milestones. But keeping up with the necessary level of compression throughout that 6 month period, I think is the best thing to do to maximize the results.
All right, Dr. Fasusi, what I'm noticing is that a lot of the clients are coming in with miscommunication with feed the fat. So they think feeding the fat is fried chicken, chips, burgers, etc. I try to remind them when we say feed the fat, we mean with good fat. What
Yeah.
would your recommendations be to
Yeah.
proper diet after surgery?
No, it's a great question. I think a lot of people take it overboard to the point where you're like, we're going to be seeing each other again soon, real soon. After surgery, there's different things I feel like are that are beneficial at different time points. One of the things within the first 6 weeks after surgery that I think everybody can benefit from is to increase their protein intake. Number one, usually that works out to about 1 to 1.5 milligrams per kilogram. In general, for most average people, that's probably about a good 150 grams of protein or whatnot, in addition to your regular diet for the first 6 weeks after surgery. What that helps you to do is because you don't see the area that's affected when it comes to liposuction, I feel like there's a misnomer that, oh, well, it's just these little incisions that's the only thing that needs to heal. No, it's a lot of area on the inside that's literally trying to heal down like Velcro. And there's things that will help that to be the case. Your nutrition is one of them that really helps you to be able to get nice, firm adhesion of the tissues sooner in the process. That can prevent things like seroma formation and things of that nature. Increased protein intake for the first 6 weeks is something I always educate my patients about. Cases, BBLs, and whatnot. Look, and I give your body the nutrients it needs. It needs all of those different components, but it needs so in a balanced way. So realistically, doing so in a way that gives you a balanced diet, the best thing that you can do when it comes to postoperative healing.
World is that I hear a lot of clients say, "Oh, I didn't know about the emotional side of it.
Mm-hmm.
I didn't know about the lymphatic drainage aspect of it."
Mm-hmm.
Or some really are uneducated about the compression garments as well, which I'm surprised to know, but a lot of them are saying, "Oh, I did not know."
Mm-hmm.
Or they don't know the grace period to when they should start the
Right.
lymphatic drainages. And like I explained to everyone, at least 24 to 48 hours if it's after liposuction. And if it is a tummy tuck, we kind of try to go by the guidelines of the surgeons because everyone has a different
Mm.
start and end with that. What I'm learning is that the emotional side of the post-op, they are not prepared for it. Everyone thinks that once I get on this table, I'm coming off looking like this superstar, and that is not the case. What would your recommendations be for that to
Yeah.
possibly add that in the recovery care? Hey, you're gonna go through an emotional phase. It's gonna
Right.
be up and down.
Right. Well, the goal is always for you to come off the table looking like a superstar. Don't get me wrong, but
Right.
one of the things that's is important to have a real discussion about is that we're not all starting from the same place, and we don't all have the same goal.
Mm-hmm.
Right? This is not a cookie cutter type of thing in plastic surgery. Each surgery, each procedure, even if it's the same procedure on three different people, each one is custom because we
Mm-hmm.
have different goals, we have different targets. And that means that the advice
Mm-hmm.
after and what to expect after is going to change depending on what you see. And where somebody may get to what their goal is in 3 weeks after
Mm-hmm.
surgery, it usually doesn't happen in 3 weeks, but I'm just saying, but somebody may of it take 6 months to 8 months to get to that
Mm-hmm.
same goal in a different element. You have to manage expectations, right? And I think the most important thing, at least for me, that I've experienced that I try to perform with each of my patients is we have a discussion and the plan and the goal have got to be lined up. Because if you have the wrong plan or if the goal is not realistic or outside the grasp of what we can do,
Mm-hmm.
then that's going to make the recovery process rocky from the get-go. The plan and the goal have to be in alignment, right? And so once you have a plan and you have a goal and they're both within reach, There's a couple different ways to be able to get there, but you can't just say, "Oh, boom, this is for you." You can have a goal, you can have a plan, but I think that it's important to know that that's going to change along the way, and there's some rearranging of kind of what you have to do depending on your particular path. Not everybody's going to have the same amount of swelling,
Hmm.
fluid, inflammation. You could have a seroma. You could have this. These are different things that can happen, which are within the realm of normal that you have to kind of like take into consideration. And if you're prepared for that because you had that discussion before surgery, it's going to be much more of a breeze when you encounter these things along the way. But if you have no idea what to expect when it comes to what I need to do with my compression, how many massages is it going to take, well, what can I prepare myself with in terms of how long I need to be in my faja, or these are things that if you don't know, it's going to catch you by surprise,
Hmm.
and it just makes the process a little more laborious, right? Having a really good understanding of that before surgery, having a very in-depth conversation with your provider before surgery, during surgery, and even after surgery is something that makes the process so much smoother. That
Absolutely.
again, one of the things I wanted to touch on that's important, I think, for the community to also be aware of is how important, specifically when you're talking about large volume liposuction cases,
Hmm.
what's required in terms of hydration after surgery.
Okay.
Because I think that there's some confusion about maybe sodium intake versus what I should be drinking pineapple juice, or I should be drinking liquid IV, or I should be drinking this, or da, da, da. I think there's a lot of confusion about it. And this is my personal practice and my personal belief. When it comes to large volume liposuction cases, hydration is of the utmost importance after surgery, and not everybody's the same. And aggressively hydrating ourselves within that first 48 hours after
Hmm.
surgery is really, really important. I think across the board, and I think that that's important no matter who you are. What you're drinking is just as important, right? One of the things I really kind of push is the need for electrolytes,
Hmm.
because when it comes to your personal fluid balance, we aren't while we're made up of water, we're made up of a lot more things than just water, right?
Right.
There's different electrolytes that are natural in our system, and we need all of those things to kind of maintain our adequate fluid balance. Really hydrating aggressively after surgery for that first 48 hours with electrolytes. Can't go wrong with Gatorade. There's a reason why professional athletes they drink Gatorade on the sideline, not just water, for example,
Right.
because it hydrates you just a lot more efficiently. Doing that aggressively for the first 48 hours is really, really key. And sodium, for example, is part of the electrolytes.
Right.
I think that there's like some confusion because I hear a lot, oh well, you shouldn't have any sodium
Hmm.
after surgery. Listen, you shouldn't have like three whole fried chickens right after surgery. That's different than
Right. Right.
than
Right.
hydrating aggressively. It's important to make sure that hydration is really, really a main focus. Because usually for most people, once they get outside that first 48 hours, they kind of just cruise. And if you want to drink more juice and
Hmm.
not necessarily, but more water, for example, and things like that, that can be added to the repertoire. But really focusing on adequate hydration with electrolytes right after a big surgery. It doesn't have to just be liposuction. There's a lot of fluid losses that happen
Hmm.
after mommy makeovers, tummy tucks, things like that. You know, you're losing fluid, and it's called insensible fluid loss to the
Right.
environment. If you have a longer case, you're just losing moisture to the environment as you're under anesthesia, and those need to be replaced very
Right.
aggressively. Without that, it just makes the recovery process a little more rocky. So focus on hydration is something that
Right.
I not only practice, but something that I also talk to my providers, my
Hmm.
nurses, my recovery
Hmm.
specialists about, because what they're having the patient's intake is
Hmm.
really, really important, and it makes the process so much smoother if you start off on the right track.
Right. And I'm glad that you made that point. When I actually bundle my packages, I actually add recovery post-op IV drips in
Mm-hmm.
my packages to help with the hydration part because a
Mm-hmm.
lot of people don't understand, like you said, how important it is to hydrate.
Yeah.
So I love that you brought that up. Tell them
Yes.
that everybody recovery process is different.
Yes.
You can't look at this person and say, "Oh, my recovery is going to be exactly like that," because it's
Yes.
not.
Exactly.
Everyone body functions differently.
Yeah. Exactly.